Welcome to another short from the Vet Med Digest. Today we focus on Neospora caninum, an obligate intracellular protozoan parasite recognized as a major cause of abortion and reproductive failure in cattle globally, leading to significant economic losses. It is also responsible for severe neurological disorders in dogs. The domestic dog plays a dual and critical role, serving as both a definitive host, where sexual reproduction occurs, and an intermediate host. The parasite's spread depends heavily on definitive hosts, like dogs, consuming tissues containing tissue cysts, such as aborted bovine fetuses or placentas, and then shedding environmentally resistant oocysts in their feces. This shedding can begin as quickly as 5 days after infection. This contamination route is vital for spreading the infection to intermediate hosts like cattle. Seroprevalence studies confirm the heightened risk associated with this cycle. Worldwide, the estimated prevalence is 17.14%. However, the risk skyrockets in specific environments. A study in central Italy found that 46% of dogs living on cattle farms were seropositive, compared to just 18% in dog breeding facilities. Being a purebred dog residing on a cattle farm emerged as a particularly strong predictor of infection. While adult dogs are often asymptomatic, clinical disease most frequently appears as neuromuscular problems, affecting young puppies congenitally or reactivating in adult dogs due to immunosuppression. Adult-onset disease presents variably, manifesting as generalized myopathy or multifocal central nervous system disease. A critical finding in clinical cases is the universal elevation of creatine kinase activity, which was increased in 100% of tested dogs in one case series, making it a useful monitoring tool. Differentiating Neospora caninum from Toxoplasma gondii is vital. Neospora caninum uses canids as definitive hosts, whereas Toxoplasma gondii uses felids. Furthermore, Neospora caninum is transmitted vertically from mother to offspring far more frequently and is prone to reactivation, a contrast to Toxoplasma gondii. Interestingly, in one unique case, immunosuppression allowed Neospora caninum to present as severe, disseminated disease following primary colitic infection in an adult dog. Given the parasite's persistence, control relies on minimizing transmission, specifically preventing dogs from scavenging on potentially infected bovine tissues, thereby breaking the dog-cattle cycle. Unfortunately, treatment only targets the rapidly multiplying acute stage and cannot eliminate the dormant stage. Thank you for listening. The link for the full podcast is below. Remember to like, share and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.